First thing I have is requests for bill introductions. Are there any? Seeing none, Megan will go over us kind of some housekeeping about the budget committee process. So, Megan, you're up.
Thank you. Good afternoon. I'm just going to run through some guidelines for the subcommittee reports. You'll remember that last year we went to an online version of the subcommittee reports, and we're going to continue that through this year. So after each budget is heard, the committee will make recommendations. Our role for a KLRD is to write those recommendations down into a document called the subcommittee report. The subcommittee report is just tracks every recommendation that the committee made. So after we're finished with it, we'll email it out to the committee, and you'll have an opportunity to look through it and make sure that the recommendations to your memory are accurate on the report. And we ask that you do this before it goes to House Appropriations. And I will include all of that information in the email that you receive saying when you need to reply by. If you choose not to reply, that's fine. An absence of a reply is considered agreeing. So if you do not reply, we'll consider that agreement that the recommendations do match what we discussed. You also have the ability to dissent. If you choose to dissent, please report that to us by the date in the email, and we will include that in the notes that we send to House Appropriations. And finally, we try to put the members' emails in the BCC line, but it's always important not to reply all for open meetings purposes. Any questions?
Committee questions. Seeing none. Very good. Thank you. Okay, first up, Shirley. Board of Pharmacy budget.
Thank you, Mr. Chair. You should have the budget analysis in front of you for the Kansas Board of Pharmacy. The arrangement and information in the budget analysis is a little bit different this year. We have the front table, and we've included a definition of the agency, and then in the executive summary, you have a bar chart for 2022, and on page 2, you have the information for 2023 in summary form. And then we have the expenditures and financing, which breaks the budgets down into the categories of expenditure. There's some information there on the pharmacy fee fund. And I will start the presentation, if there are no questions, on page 6, where we start with fiscal year 2022 budget analysis. So you'll see in the table that there's an approved budget from last year's legislative session of $3.8 million. The agency's revised estimate includes some increases in salaries and wages and contractual services with some decreases in commodities for a budget of $4.1 million. And the governor agrees with the agency's revised estimate. Questions? Do you want me to go on?
Committee questions on 2022. Please go on to 2023.
Okay. One new feature on page 7 in the budget analysis is oftentimes we get a request to look at the 21 actuals versus the 22 requests. So we have added a table which will give you some information on the differences between what the 21 actuals were and the 22 agencies request. A couple of things I will note in the differences there. There was the passage last year of HB 2066 concerning occupation and professional licensing standards and increasing the ease of getting military personnel and their spouses licensed, and the agency last year during Omnibus had asked for additional money in an FTE position. So those were some of the changes in 22. And then you'll see in that second paragraph that there's also a new grant, the U.S. Department of Health and Human Services Substance Abuse and Mental Health Services Administration grant, which the agency received. Moving on to page 8 for fiscal year 2023. Again, this is a biennial, so we have an approved budget of $3.7 million. The agency does have a supplemental request of $40,000, and then there were additional changes of $116,000 for salaries and wages, fringe benefit costs, and offset by some decreases in commodities and office supplies. And again, they have the new grant of $157,000. For additional information on that supplemental request on page 9, it's for continual support of HB 2066. One of the things last year was in the fiscal notes, we added the money for 2022, but we did not add it to 2023, even though we had a 2023 budget last year with the legislature. So that's just adding the additional money that was added in 2022. And the governor does recommend adoption of this request.
Representative Donahoe.
Thank you, Mr. Chairman. So what is the new grant? It says the increase is 156 due to a new grant. What does that entail?
If I could, Mr. Chair, Alexandra Blasi's here, and I unfortunately did not bring additional information on the grant, but I'm sure she'd be able to supply that.
Very good.
Also, if I may, so what is the percentage increase in salaries 23 versus 22? Is it?
I'd have to calculate that real quick, and I can get back to you on that.
Okay. Was it higher or lower, do you recall?
On salaries
As
and
a
wages, on page 3, the table at the top of page 3,
Yep.
you've got in 22, you've got salaries and wages of 1.5 million, and the 2023 is 1.6 million. So there's about $1 million increase in salaries and wages. I just don't have those percentages with me. I'd have to calculate it.
Okay, that's sufficient.
Okay.
And the number of employees?
The number of FTE are 18.5 in 22 and 18.8 in 23. However, that does not correlate to head count. I don't have the head count figures with me, but it is 18.5 FTE in 22 and 18.8 in 23.
How does it not correlate? I don't understand.
Full-time equivalent position could be 2 half-time people.
Okay.
Or 4 part-time people. It's not 1-to-1.
Okay. So it's $1 million increase for 18 people? Is that what I'm understanding?
Well, it's a 1.5 total for 18 people. The total salaries and wages is 1.5 million.
But I thought you said it was $1 million increase.
I'm sorry, it's a $100,000 increase. Sorry.
So I was going to apply for that.
I'm surprised I wasn't getting hit in the back of the head
I was
there.
going to apply for those jobs if that was the case.
Committee for
Thank you, Mr. Chairman.
Representative Clifford.
Yes, so thank you, Mr. Chairman. Is the K-Trax program in your budget?
Yes.
And is it being supported now by federal funds and where we will have to pick it up as a state general fund expense item? Thank you.
There was a bill last year with the Attorney General. There are some lawsuits, opioid lawsuits, and they are getting settlement payments from those. And as part of the bill, there was a new fund created for K-Trax, and there is a transfer of $200,000 a year into that fund from the Attorney General's office.
Thank you.
Committee, further questions? Well, committee, I just want to bring to your attention, this is so much easier than our previous budgets. For instance, right here, just looking, agency request supplemental, it's numbered, so for people that are challenged like I am, I can see the one up there, and then I can also see the one down here, and two, and so on. So if you look on two, the adjustments, the increase and the decrease and the SAMHSA grant come out to the same amount of money. They're on 116,000. So it's very easy to follow versus what I've had to deal with and what this committee has had to deal with in the past. So after we get used to it, I think it'll be very well understanding, very easy to understand. But I might, to Representative Clifford's deal, this is probably one program that I would certainly, and I think this committee would agree, we could fund this out of SGF and certainly prove the value to our citizens in the fact that we prevent so much opioid addiction. We catch so many people that are doctor shopping and all that kind of stuff to get these prescriptions. And as Shirley will know, and some of the committee members will know, we've went through some very creative ways of funding K-Trax over the last several years, from transfers from the Board of Healing Arts to the nursing, and optometrists paid a little bit. So Alexandra will explain all that to you when she gets up here, and you'll be, and now they're funded almost entirely by grants and all kinds of other stuff. So anyway, committee, further questions? Thank you, Shirley.
Thank you.
Okay, next, Alexandra, you are up.
Thank you, Mr. Chairman and members of committee. It's lovely to be with you today. My name is Alexandra Blasi. I'm the Executive Director at the Kansas State Board of Pharmacy. And you do have quite a number of papers in your packet from me today, but I'm going to try to simplify a little bit. The second document that you have that's in color, I'm going to talk about in just a moment, but that is our K-Trax annual report. And I'm not going to go through the whole thing, just highlight a couple of things for you. But before I do that, I would very much like to talk about our regulatory program, which actually is the general basis for the Board of Pharmacy, and that's what manages all of the different pharmacists and pharmacy personnel, in addition to all of the different facilities in the state of Kansas that have or distribute and manage drugs. So we do have a significant responsibility and mission to protect the public, and we take that very seriously. The board does concur with the governor's recommendation for the budget for fiscal year 2022 and 2023, and greatly appreciates the ongoing support and assistance from the Division of Budget and Governor's Office over the past several years as we have navigated a challenging topic of funding the K-Trax program in particular. So within our regulatory program, I did want to highlight a couple of things. One is related to our enhancement request related to the position. And to respond to Representative Donahoe's question, it's about a $77,000 increase from fiscal year 22 to 23, which constitutes about 5% of our salaries. So that's the 5% increase that you see there. And that is very specifically related to House Bill 2066 from last year. And the board has worked very hard to update its policies and procedures to accommodate the requirements of that bill that basically provide us with 15 days for all military, veteran, and military spouse service members to respond to a new application, and 45 days for all other individuals. And while that is a very reasonable timeline for applicants that have submitted a complete application, we find that that 45-day timeline is particularly problematic when it comes to individuals that have a criminal history that is often either misrepresented in some fashion or not disclosed on the application itself. And so we are struggling with that 45-day timeline for those applicants that have a criminal history, and it has taken a significant toll on our agency resources and personnel. And so we have made adjustments to meet these requirements and are hopefully going to be reporting out strong metrics on meeting those timelines beginning next fiscal year. So Kansas licensed pharmacists have actually increased by 62% over the last decade, mostly in the last 5 years. And over 2/3 of these pharmacists reside in Kansas or in our neighboring surrounding states. Technicians have maintained a steady number over the last several years, but pharmacist interns or students in pharmacy school have actually dropped by about 10%, primarily due to the decreases in applications for admission in the state of Kansas. That is outside of the board's control, but it will likely impact the future of the licensed pharmacist community in the state of Kansas. We have seen a slight decrease in the number of applications we've been able to process within 30 days of receipt. In part, this is because of the pandemic and the increase in volume and workload that our agency has seen, but it's also because of the change in House Bill 2066. So we are working on this and hope to bring up these metrics very soon. However, we did have an increase in our percentage of online renewals this year, up to 98.8%, and so we're very pleased to see that number. On the compliance side of things, where we're actually looking at individuals that are staff inspectors that are going out and doing inspections of facilities, we have some pretty good numbers on making sure that we are getting all of those facilities inspected within the previous 24 months. Even during the pandemic, we were able to move to a virtual and paper audit process to ensure that inspections were still being conducted routinely. And then for all other facilities, we have a 36-month timeline for reinspection of all of those facilities. And you can see that we have about a 92% increase, or excuse me, a 92% completion rate for facilities, and 73% for the 36-month facilities in 2020. And then year to date, that's about 80%, but we look for that to improve this spring as we are moving through and having more in-person inspections due to the decreases in the pandemic levels. The board also has noted an increase in the number of technician applicants reporting discipline or criminal offense history. And so we have seen denials remain steady at about 24% of the total applications that we review in that capacity. But I will note overall for our agency, denials is representative of only 0.5% of the applications that we see at the board. So all of the other applications are approved in some form. If anyone has questions about the regulatory program, I would be more than happy to answer those before I move on to the K-TRACS program.
Committee questions? Please move on.
Wonderful. So within our drug monitoring program, of course, I mentioned the K-TRACS program, which I'll mention in just a moment. But one thing I like to highlight each year is that the board operates a program called the Kansas Medication Disposal Program and the Utilization of Unused Medications Donation Program. And since the inception of that secondary program, Unused Medications, about 10 years ago, OptumRx, a mail order facility in Overland Park, they have donated over $44.6 million of medication to indigent patients in the state of Kansas. This is a phenomenal number, and we have been recently in contact with OptumRx to talk about changes to that program that could actually increase the availability of some of these unused medications at low costs or no cost to indigent patients all over the state of Kansas. In addition, the board operates the Kansas Prescription Drug Monitoring Program, which I've mentioned is called K-TRACS. It's a vital tool and potent tool used by healthcare professionals to enhance patient care and aid in the identification of patients with drug-seeking behaviors. We have put together a 2022 legislative report, which is available for you, and I've highlighted a couple of graphs in my testimony. One is the increase in the number of registered prescribers and pharmacists. As you can see, the 2021 numbers have just continued to leap up, which is fantastic. That means people are engaged and using the program. In addition, we also underwent a change in our program this year to require all individuals that use our integrated system, so when the KTRACS information comes directly into their electronic health record system, that they also have to be registered and have an account so that we can verify their credentials when we are passing that information across to the electronic health system. And as a result of that, we have seen our numbers increase, but we've also cleaned up a lot of old accounts and ensured that all of the people that are registered should be registered and are properly licensed in the state of Kansas, which is a really good thing for such sensitive information. The second graph indicates the number of searches, queries into the KTRACS system by month and by type. You can see that actually the number of web searches has sort of leveled off in recent years, while the number of integration searches, those in those electronic health records, has gone above and beyond anything we could have ever expected. In fact, I think I was here just a couple of years ago noting the tremendous increase we had seen over several years. And then when you look at 21, it just continues to increase from there. We do attribute some of this to the pandemic and the use of technology throughout the pandemic, as providers are using telemedicine and other ways to communicate with patients and to review patient information. Despite continued grant applications and successful awards, funding has presented the most significant obstacle to maintaining KTRACS, and we have worked very hard with this committee, other legislators, and our KTRACS stakeholder family to bring solutions that are both long-term and permanent and sustainable for the Kansas system. This year, and last year as well, our presentation of plan funding, includes transferring the $200,000 annually from the Kansas Opioid Litigation Settlement Fund as funds remain available, increasing the expenditure authority to support this from the Kansas Pharmacy Fee Fund in the interim. We also added a non-resident fee that helps support the program. Creating a fee-based structure for participants in the KTRACS integration program if and when federal grant funding is no longer available. And then, brand new this year, creating a tax deduction for donations to the KTRACS program. Donations to the KTRACS program are already permitted, and we are able to receive those, but we never have received any. So we were thinking that an incentive to donate might be on the menu and would enable people to more readily be available to donate to this program. We don't know what that amount might look like year to year, but we have introduced House Bill 2558, and we hope that the House Tax Committee might take that up and hear that bill this year. In addition, we have introduced House Bill 2253 last year and Senate Bill 168, its Senate correlate, which have not yet been heard by either legislative chamber, but we are working on that. Notably, this is the funding solution for the integration costs. While we do expect that federal funding will continue to remain for this program, we want to have a backup plan in case it should end in the next several years. And so we want to be able to enable that funding piece if we have to at that time. Of course, the KTRACS program, the base level software, would always remain free to any user. This would just be for that enhanced element of having it incorporated into your electronic systems. So you can see right there, I've outlined the fee funding for KTRACS as well as the federal grant funding in recent years. To Representative Donahoe's question about the new grant, we are actually a subrecipient of this grant through the Department of Aging and Disability Services. There are a couple of key components. One is that we are actually working on the statewide plan for that grant itself. So we are partnering with KDADS on that. So there's a staff component to that. But most of the grant focuses on two pieces, and that's education. So reaching out to the prescriber and pharmacist community and educating them on the benefits and availability of KTRACS and how the tool can be best used in a clinical setting. And then the compliance piece really centers around appropriate and consistent accurate reporting to the KTRACS program. So when pharmacies are reporting out their information and sending that through the clearinghouse to KTRACS, making sure that it is accurate data, that it is timely reported, and that it is, if there are errors, that those errors are being corrected. So we really are trying to focus on data quality with that federal grant. I believe the question was raised, what will we do when the federal grant funding is no longer available? Well, we are really trying to focus on grant projects that would be through the life of the program and then come to their natural end. So we would not anticipate moving forward having to pick up those costs in the future using SGF or any other source of state funding, that we would seek other grants for other projects and keep that fresh and recycling and not necessarily having to bring it into our base level maintenance funding. In addition to the proposed budget, obviously, I would like to highlight that the board strongly supports the governor's recommendation to increase staff salaries by 5% beginning in fiscal year 2023. I don't know if this is something this committee will take up, but I did want to mention that the board's fee fund can absorb this impact without any assistance or fee increases. And while the board occasionally offers appropriate merit-based increases and promotions to employees, existing salary levels have stifled recruitment and retention in recent years. In addition, existing board staff have worked exceptionally hard for the past 2 years. We have an incredible team at the Board of Pharmacy. I'm very proud of them, and I'm pleased and honored to work alongside them. They've demonstrated impressive flexibility and dedication despite unprecedented challenges. All the while, staff have experienced increased costs for goods, groceries, and gasoline that have a substantial impact on their daily living, especially for some of our staff who earn less than $15 per hour. The board would strongly encourage the legislature to consider recognizing and supporting state employees by approving a salary increase this year. And with that, I would be happy to stand for any questions.
Any questions? Representative Ballard.
Thank you, Mr. Chairman. I think you covered the area I want to go to, but you went over it really quickly in terms of unused medications. And I think that's a really big deal. And I want to really highlight that for people that don't know, because if you just said it, it was just kind of went along. But actually, you may want to explain how that came about, the bill that we actually passed probably about 15 years ago, maybe, along that, and how we ended up using those unused medications to help those who might have had financially a difficult time paying for them.
Absolutely. Thank you, Representative, for the opportunity to provide more information about that. So as you mentioned, many years ago, this Kansas legislature introduced a bill, which I believe Representative Ballard helped work on, that provided an opportunity for medications that had come out of stock but had not yet been delivered to the end user patient. And those medications, because of the restrictions in both the federal level and at the state level, those medications that have come out of stock but not been provided to the end user cannot be returned to stock. It is unsafe. So most of the time, these medications just get sent back through the supply chain and they're wasted. But Kansas has developed an opportunity for those medications, as long as they've been verified and are safe and have not been tampered with or adulterated, they can be donated to a drug depot in Southeast Kansas. And then indigent clinics and other entities can apply to that depot for shipments and amounts of that medication. Most of them go to federally qualified healthcare centers. And so indigent patients can then receive those medications for either low cost or no cost, which they're very safe and they're perfectly safe to be provided to patients, but they can't go through the normal chain of prescribing and dispensing. So over the life of the program, as I mentioned, $44.6 million of donated medications. That's the fair market value of those medications. And then just 2021 year to date, at the time that we submitted this budget back in September, was $1.8 million just for that year. Usually the total amount ranges from $3 to $5 million each year. So it is a very substantial contribution. And there's really, there are several contributors, but one in particular in Overland Park called OptumRx. It's a large mail order pharmacy.
Thank you, Mr. Chairman. I think that is well worth highlighting, Because often, there are people who will say, well, what does the state do for me? And that wasn't asked by anyone. It was legislators thinking in terms of how to use that medication to help people. And at the same time, we may have RX and we have all those different things that give you a reduction. But this is medication that would probably have been thrown away and not used. And the legislature found a way through a bill in order to do this. And you think we have saved over $44.6 million. And we have heard from some of those people that were so grateful to receive these medications who could not afford them and probably did not have insurance. And I can tell you about two people that her medications were running her $1,200 a month. And who has $1,200 a month? I mean, even someone who's working with a good job would have a hard time with $1,200 a month just on medications when you have other households. And we have found a way, and I would have to say Alexander has kept us informed all the time about the value of this program and how it helps the whole state of Kansas, by being part of it. So I just wanted that highlighted and to thank her, because I think she has to buy into it and monitor it and make sure that there's a lot going on. So thank you so much.
Representative Clifford.
So thank you for your report today, and I'm a physician prescriber, so I've already read your report, and I thought it was excellent on K-Trax. I'm new here, so I may say things that are outrageous. It seems like we're getting stiffed on the opioid fund transfer. To my reading, there's a massive settlement with the states, and I guess in my time here, I'll follow the money to see where else it's going. But to my mind, that settlement money ought to completely be funding K-Trax. Do you have any position on that?
I don't know that we have been anything but grateful for the opportunity to even have those funds. It has been quite a conversation to get any additional funding into the program that wasn't regulatory fee fund contributions. And thank you so much to the chair, because he really has spearheaded the campaign to change that and to evolve the program into a different funding scenario. Last year, the board was exceptionally grateful to just receive the $200,000 transfer each year. Our base level maintenance budget right now is only about $250,000. So that $200,000 goes a long way to covering our day-to-day expenses. It doesn't get us all the way there, but we think it is a significant contribution. We would also, my understanding of the settlement is that it's there until we will run out of it at some point. We would much rather see future years of transfers into the program than use up all the money all at once and then have to find an alternate source of funding. But certainly the board is open to any conversation about what the appropriate amount of transfer would be.
Thank you. But if there's any purpose for K-Trax, it's to track opioids.
Absolutely.
Obviously. So, but I appreciate your comments. Thank you, Mr. Chairman.
Representative Lynn.
Thank you, Mr. Chairman. Am I remembering this correctly? I was thinking that K-Trax was integrated with other states' systems.
Yes, that is through we use a couple of different terms. Integration we use to refer to the integration of the data into the electronic system workflow. When we're talking about our other states, we use the term interconnectedness. So yes, we do have interstate agreements with 30 plus states, and as well as the VA, the military health system, the Indian health system. And so we are able to share data with those states. And I want to be very clear, we're not actually sharing it with the states themselves, we're sharing it with the providers in those states. And likewise, they share data with us. So it is a two-way connection street.
And Missouri is one of them, correct?
Yes, Missouri is a little bit different because Missouri just last year passed a statewide prescription monitoring program. They currently are operating only under a county-by-county approach, but we do share data with them.
Thank you, Mr. Chair.
Any further questions? On page, on the second page here of your funding sources, pharmacy fee fund, I see it's 981,000. This year, it was 10,000 last year. So,
Yes, I'd be happy to explain that.
okay, very good.
Mr. Chair, if you see the third row down that says CDC grant, that $921,000 there, we do not get to know from the CDC what our allocation of funding is for that federal grant until August. So we do anticipate that there will be a CDC grant in fiscal year 2023 that will negate out a significant amount of that pharmacy fee fund, but we are not able to demonstrate that in a budget capacity until we officially have that information from the federal government. So we are cautiously optimistic about receiving another year of CDC grant funding in fiscal year 23. But we are preparing just in case the opposite should happen.
Well, very good, because the committee on page 3, you can kind of see how the fee fund runs across there. It's in ours, but you have it, okay. And that would probably seriously put a hurt in your fee fund.
Yes. And as I mentioned, we did add that non-resident fee last year to help supplement some of the K-Trax funding within our pharmacy fee fund. And we are just beginning to see the results of that in terms of revenue. So we have also cautiously projected our revenue.
Very good. Committee, further questions? And what is the balance in your fee fund now?
May I ask my assistant director? Thank you. So for closeout for December 31, month end was $2.4 million.
Very good. Committee, further questions?
Just one.
Representative Ballard.
Thank you. I think the chairman had mentioned all the creativity we did in terms of the budgets and making it work. And actually, before we had any funding at all, the state knew how important it was, and we jumped in and tried to do what we were. And the different agencies, they may not were thrilled, but they did agree to contribute their share for their constituents. Is there another area that you would like to have that you don't have, or that you think we should consider looking at?
I don't believe so at this time. I mean, we are constantly pursuing new grant opportunities and new projects and enhancements. But like I said, we are really focused on those being short-term projects that can have either one-time and permanent implementation, or a shorter-term project that would not require supplemental funding long-term.
And you should be commended for that. I asked that question so I could say you should be commended for that, because when we were scrambling, trying to find the funding and everything else, it made it a lot easier for us to justify by saying you were actively seeking grants, that you were trying to help yourself, and that kind of thing, instead of just waiting for us to give it to you. And I think you should be commended for that, because that made it possible for us to get to this point. So thank you very much.
Okay, very good. Thank you.
Thank you,
for
sir.
being here. Okay, next up, I have Dayton Lemunion. And Dayton is going to give us the Board of Mortuary Arts budget.
Good afternoon, Mr. Chair, members of the committee. I will be presenting the Kansas Board of Mortuary Arts budget today. The Board of Mortuary Arts regulates all those involved in the mortuary arts field, as well as the businesses, and you can see that on the front page. I'm joined today by an agency representative, J.W. Carey, who will stand for any questions you all may have. The Kansas State Board of Mortuary Arts is a fully fee-funded agency. And in the document, as Shirley mentioned, the first few pages, they're mostly summary information that I'll provide more detail on during my presentation. So let's go ahead and begin on page 7, unless anyone has questions. And on page 7, this is the current year, the fiscal year 2022. The agency estimates revised expenditures of $367,000 in fiscal year 2022. This is a decrease of $1,163 or 0.32% below the fiscal year 2022 approved amount. The agency requests 3.0 FTE positions, which is the same as the approved number. And as the chair mentioned, you can see 2, 3, and 4 key to the table at the top, and these are all changes in benefits. There's a decrease in the employer contribution for CAPERS, and that decrease is offset by an increase in unemployment insurance and group health and hospitalization insurance. And that creates that net decrease of $1,163. And the governor does concur. Moving on to the next page, page 8. As Shirley mentioned, this is the change from actual table, new this year. So you will see an increase of $82,000 or 29% over fiscal year 2021. This is primarily due to the funeral home inspector being on leave and a temporary inspector being employed. So essentially paying for both of those positions. There's also an increase due to the inspector resuming travel following the pandemic. So I will now pause for any questions you all may have.
Committee questions on 2022? Go ahead.
Okay. We'll move on to the next page, page 9, which is the budget year, fiscal year 2023. For this year, the agency estimates revised expenditures of $308,394. This is all from the Mortuary Arts Fee Fund for fiscal year 2023, and this is no change from the approved amount. Although you will see in number 2, although there is no net change, there is a change within the agency's budget. They have an increase of $1,195 for computer replacement, and this increase is offset by reductions in fringe benefit expenditures, creating a net change of 0. And the governor does concur with this request. So the remainder of the document provides program and performance measure information that I will not go into, but I'm happy to answer any questions. And I'll now stand for questions on the 2023 budget or the budget as a whole.
Very good. Committee questions? Committee, this is the kind of budget we like. It's entirely fee funded. We don't have any state general fund in it, nothing. They pay their own bills out of fees they inspect their own facilities. What else can you say? So, very good.
All right, then if you'd like, I can move on to the Guardianship Program. Let's get JW up here and introduce himself, and we'll finish up this one first. Okay, very good. JW Carey.
I am J.W. Carey. I'm the Executive Secretary of the Kansas State Board of Executive Secretary of the Kansas State Board of Mortuary Arts. And as you said, we are a fully funded fee fund board, and we really don't have too much to ask for. You know, there's nothing out of the state general fund or anything like that. One of the situations that we did run into with our inspector, he had a long-term illness, and we tried to get a temporary inspector position approved, which we did. And then unfortunately, he passed away. So we are in the matter of trying to hire a new full-time inspector. And so I don't think that probably even some of the money that we had approved, we will use all this year because we didn't overlap. But I will stand for any questions that anybody has.
So what happened to the guy that was here last year? And I forgot his name. You know who I'm talking about? He was here for a number of years. Is that who you're talking about passed away?
No, I was here last year, but it was my first year. You're thinking of Mac Smith. Yeah, Mac has since retired. Okay. And I took his position. Mac was here for, gosh, Pam, almost 40 years, 39 years. As the executive secretary, and our inspector, Francis Mills, was here for 36 years. that tells you how long that this has been, they were a duo. And so I'm kind of in rarefied air, I may say, as to being new on the position and also new to some of the challenges that we've just faced in this last year.
Well, very good, thank you. I'm glad he didn't pass away. When I heard that, I thought, oh, I hope it isn't him, so.
Mac's still the mayor of Silver Lake, sir.
Oh, very good, very good. Representative Helmer.
What does an inspector do?
What's his position, or what are his duties? Basically, our inspector will go ahead and inspect the facility. Statutorily, it is once a year, okay? And to basically, it's to check, make sure that the safety and the welfare of the public is being followed. Also, anything that is generated by complaint or anything else like that, the inspector can go out for that as well.
Thank you, Mr. Chairman.
Representative Bowden.
Thank you. When you say it takes appropriate disciplinary measures, when you're inspection, do they get this sheet with what their responsibilities are, or is that included in the licensure?
As I'm not follow, I apologize, Representative Bowden.
Right. You license funeral homes.
Correct.
Crematories.
We license establishments as well as the individual licensees themselves.
And it says here, and takes appropriate disciplinary measures if warranted.
If warranted, that is correct. If there were a complaint or anything else like that, we do have disciplinary actions that are available to us by statute.
Now, the other part of my question was, are there printed guidelines, responsibilities, and everything else when they apply for a license so that they know what they're supposed to be doing and everything else?
Yes, the Kansas State Board of Mortuary Arts has a rule book, and it is available for free PDF form. It has all the selected laws and things like that that any licensee needs to know to follow. They're also, as far as for their licensure, they're also asked to test on the Kansas law and everything of that nature, as well as to cover some of the federal laws and things like that.
You're helping me out a lot, because actually for the first time 2 weeks ago, I received a letter from someone whose husband had passed away, and she had no idea about the procedure and what was going on. And I knew this was coming up, so you're lucky day. So when I look at it, the board also informs Kansas consumers about laws related to the death process, the funeral arrangements, and funeral process.
That is correct.
I think in all the years I've been here, I've never seen it.
The
process, the laws. I mean, what do you send out?
The actual rule book itself, like I said, it is located on our website. I can't remember, gosh, I was trying to think of how many pages it is, but it is select laws that do govern mortuary arts and things like that.
Okay, so it's on the website. Is there anything that when people come in to funeral homes or crematories that they receive that has this information, especially if they choose or cannot go to the website?
Not to my knowledge.
Okay, so they would have to go to your website to find out about the funeral prearrangements and the processes and everything else?
Yes, you can. That's what the website is there for information such as that.
Okay, but if they come into an establishment, they haven't seen it, maybe they got it from a friend because they knew about it and they liked the service or anything else, do the funeral directors have a handout or something that they give them? I know they agree with what the arrangement might be, what you want during your service and everything else, but do they provide just information in general if they haven't made up their mind which funeral home they'd like to go to?
Well, any under the FTC rule and the Federal Trade Commission rule, all funeral homes have to provide anybody that asks for it with a price list and things like that. Now, as far as for, if you're speaking of planning or anything else like that, multiple funeral homes have things that they hand out as to where wishes can be written down or anything that the consumer may want.
I think you've answered it. Thank you so much. I appreciate it. Thank you, Mr. Chairman.
Thank you, Representative Ballard.
Very good. Committee, further questions? Representative Howerton.
Thank you, Mr. Chair. I'm just curious, do you guys get raises this year, or are you requesting? There's no increase for salaries or?
This
is the first budget I've seen without that.
I know we at this time, and I do appreciate the Kansas State Board of Mortuary Arts. We're an extremely small agency. Like I said, we only have 3 full-time employees. We would not hesitate about the 5% as we looked at it last year too, and we're kind of hoping it would be passed. But this is a good time that I could mention that we would not hesitate to have a 5% raise. And by the time I would have to go back with our budget analyst and things like that, but I don't foresee that being a problem as to being.
So it's not
capable.
a matter of fees, it's just a matter of you didn't budget it?
For the 5% raise, not at this time, no.
The 5% global increase is not reflected in this budget, or I think in any of our budget presentations, because it's a global change. So that's a below the line change.
Okay, so for us freshmen, what does that mean?
So none of the budget analyses, and Megan, will you correct me if, yes, they're not, the 5% is not reflected in any of our budgets. The numbers that we've run or the totals that we've given you don't reflect the 5% increase that would come with the governor's.
So the other increases were just health insurance or something like that? In the last budget, we saw an increase in salaries, right? Okay.
But that wouldn't involve the 5%. That's just an internal
Okay.
deal where they've hired another employee or something like that.
Okay, thank you. Thank
Yeah.
you for that clarification. Thank you.
Or the other thing is, this was in the governor's budget. That doesn't mean that that's going to take place. We have to pass a budget in order for that 5% to be realized.
When they say globally, we'll deal with this in appropriations on a large scale. The Senate will deal with it just like we did last year. And as a matter of fact, it didn't happen last year. So, oh, no worries.
No, but I'm glad you asked because you need to know.
Representative Clifford.
Thank you, Mr. Chairman. Just a point of order, since I'm new to this, and as the county commissioner, I'm accustomed to taking budgets under advisement, and then we county commissioners later are the appropriations committee as well. So I realize we have an opportunity for feedback, but what's the next step for us to get it to appropriations? I don't understand.
Tomorrow, we will take any committee recs here. So if you have any ideas about how to change these budgets, you will email that like this through that process there, and then we'll deal with it in committee tomorrow. And then that will become part of our subcommittee recommendations when I report this budget. I and Representative Ballard report this out to appropriations. So, and then they can either take those out or line item veto them or whatever they want to the appropriations committee. Should that pass, then it would become part of the appropriations bill for the House.
Thank you.
Then the Senate does the same thing, and then we come together in the conference committee and go that way. Yeah, I'm sorry, I should have probably mentioned that earlier. And just committee, on page 6, you'll see here is a list of their the fees, the various licensing fees that they charge for that. And you're well within your range of statutory fees and probably not in danger of having to raise your statutory cap or anything like that.
No, not at this point in time. As a matter of fact, our fees have not been raised for over 2006.
Okay, very good. Committee, further questions? JW, thank you for being here and hope to see, Representative Helmer, sorry.
This may be out of order, but I have to ask it for a constituent. When someone's cremated, are bodies put by themselves or are they mixed?
No, they're supposed to be individually cremated.
Okay, thank you very much, because I've had repeated requests knowing that we were going to have sometime this year. So I can answer that question. Thank you very much. You're welcome. Thank you, Mr. Chair.
Very good. Committee, further questions? Okay, thank you very much.
Thank you.
Okay. Dayton, you're up next.
All right, and now we'll move on to the Guardianship Program. So that will be a different document. It says Guardianship Program at the top. All right, so I will be presenting the Kansas Guardianship Program. Again, this is you can see on the front page the totals as well as the funding breakdown and a description of the agency. I also have with me an agency representative, Jean Cran, who will present after me. And again, the first couple pages are summary information, so we'll begin on page 4. Page 4 at the top says Fiscal Year 2022 Analysis. Looking at the middle of the page, the agency estimates revised expenditures of $1.4 million, all SGF. This is the same as the agency's fiscal year 2022 approved amount, and the agency requests 10.0 FTE positions, which is the same as the agency's approved amount for the year. There is no net change for the agency, although they do have decreased expenditures on salaries and wages. This is due to a long-term employee retiring and that employee being replaced with an employee who receives a lower salary. This decrease is offset by increased expenditures on travel following the COVID pandemic. And the governor does concur with this request. Moving on to page 8, we can see the change from actual expenditures in 2021. The primary reason for this increase is an increase in volunteer stipends from $30 to $40 and increased travel, as I mentioned. And I'll now take questions on fiscal year 2022 budget.
Committee questions on 22. Seeing none.
All right, then we'll move on to the next page, page 6. The agency requests $1.4 million, all state general fund for fiscal year 2023. This is the same as the fiscal year 2022 revised estimate. The agency requests 10 FTE positions, which is the same as the revised estimate of the previous year. And there are no changes requested by the agency. So the governor concurs with the agency's request for fiscal year 2023. And again, the remainder is just program and performance measure information. So I'll now stand for questions on this year or any other questions on the budget.
Any questions? Seeing none. Thank you, Dayton.
Thank you, Mr. Chair. Thank you, committee.
Jean, you're up. Jean, why don't we let Representative Ballard do your presentation for you? She could very easily. Thank you for being here, Jean. I was just joking with her. But anyway, thank you. Good to see you back again. And
thank you. Thank you for the opportunity to breathe. I just unmasked, so I was holding my breath. Okay, thank you for the opportunity to be here and to tell you all a little bit about what it is that we do. I can hear that some of you are new to this committee, and so I will take a few moments to do a recap. You should have received through your budget analyst, and I can see that your trusty recorder here has a copy of the Guardianship Program Annual Report. And so that is basically the document that I'm going to be walking through. And just to give you a few highlights. Before that, I thought it might be helpful for those of you who are newer to put what we do in the context of guardianship in Kansas. So First of all, guardianship and conservatorship, Kansas distinguishes between guardian of the person and conservatorship of the estate or finances. And in that, you have a mechanism by which there's a court review. You bring a petition to the court, you ask the court for the appointment of a guardian or conservator or both, and then the court makes that determination. Is there a need? And then who is appointed? So in Kansas, who is appointed, you may have, it is considered generally, not just in Kansas, but across the country, that the majority of guardianships would be family members, immediate or extended family members. And then, of course, you have other types of scenarios. You may have a large estate where there's a business aspect that needs to be managed and run. And so in some cases, if there's not an individual or an attorney to do that, a bank or a banking institution may fulfill that type of responsibility. There are private individuals who do this basically as a business, and that means they are looking to an estate that would have some possibility for garnering a fee for the service that they're providing. There are attorneys who do this, and then there is a nonprofit corporation for those of you who are in the Kansas City area. It's called RCare. It grew out of the early days of the Association for, at the time, Retarded Citizens. That was the terminology of the day. And they were looking to be able to have an entity that could continue when family was not able to. So the last formalized entity out there that does guardianship is our program. So if you think about that big picture, you think about that umbrella, that's one piece that I want you all to be aware of. The other is that the statute for guardianship and conservatorship encompasses minors all the way through the entire age span. Some states may have a different statute for children or for elders or for persons with intellectual or developmental disabilities, but that's not the case in our state. So it would encompass individuals who have resources, people who have no money, people who have family, people who don't have family. The whole spectrum is basically covered under this one statute. One of the phrases that we use out in the field, and you'll hear that from time to time, is the phrase alternatives to guardianship or least restrictive. What does that mean? So if you look at a continuum and you think about the types of supports that a person may need, it may start out being fairly nominal. It may mean that the person could get some individual social services supports. It may be that if those programs might be through the state, or if the person can afford them, they might be through a home health agency or another group. If we're talking about money, there's a mechanism through Social Security for someone to be named as the person to handle money. And so there's also an equal partner parallel, I guess, to that, and that would be the Veterans Administration would have some way to name someone to handle money. And then you go through and it keeps starting to ratchet up. Now we're talking about decision-making for health care. We're talking about durable power of attorney for health care, durable power of attorney for finances. And all of these require that the person has some ability to be able to say, I want this agent, this person to be my decision maker, and I'm aware of what I'm asking them to do. Then we move into, you'll hear some terminology about supported decision making, and then we start moving into the statutory pieces relative to guardianship and conservatorship. And there's creatures out there called voluntary conservatorships, which means I know I need some help with my money, but I can't fight off the family member who keeps showing up when my check arrives. But I know what's going on. And then we go all the way through guardianship and conservatorship. So I wanted to create that template for you, as it were, to sort of see where our program fits in. So we are a volunteer-based program that provides guardianship and conservatorship for certain individuals. So in your report, you're going to see who that group is. First of all, we are a funny little entity developed back in 1995. We're a quasi-public instrumentality, and you can go to your folks who've been around for a long time and they can do the interpretive on that. But basically, it means that we come before you relative to budgets. We receive state funding to do that. And these are my words, we sort of function then somewhat like a nonprofit in terms of how we behave, I guess, is to make that. We have a governing board of directors, and Representative Carpenter's reference to Representative Ballard is we are privileged to have her serve on our board of directors, and grateful for this committee's support ongoingly, and also for Representative Ballard. So in your report, every year there are people that the court adjudicates in need of a guardian or conservator. Some of those people, as I mentioned earlier, have family members, others do not. And so we are one sliver of the guardianship picture out there. And so, as mentioned, we do that through recruiting and training volunteers, and we work collaboratively with Adult Protective Services, with the Department for Children and Families, and also with KDADS, the state hospital institutions. If any of you are familiar with court-appointed special advocates for children, this has some elements of that, in that it is a court appointment. And what we ask people to do is to basically step in and be the person to make the informed legal decisions when a case has gone to court and comes under our jurisdiction. So basically, when you're the guardian or the conservator for somebody, you need to know something about them, you need to get to know them, and you have responsibilities. Your job is to advocate and take action on behalf of that person. You want to be part of the decision-making to help them access services and supports that they need, whether that's community services, whether that's home and community-based services through the waivers, and you're going to hear a lot about that, I think, in this committee, or already have. There are a host of medical care type decisions that a guardian would be involved in making. And then the other part to that is, so how is this going? We have this service now, and we need to know, is it in place? Is it doing what it's supposed to be doing? Is there a breakdown in that? Do we need to make changes? Or do we applaud it and say, we have what we need for this individual? There's accountability with a court appointment, in that there's a guardian report to the court annually, and if you are the conservator handling the money, there is an accounting that gets filed with the court. In terms of when we ask somebody to take this on, as you can imagine, it's not something that is done lightly, and we anticipate when we speak with you about that, it's something you're going to do in your foreseeable future. We don't have a crystal ball, neither do people, but it is the idea that you're in a relationship with somebody, you're making decisions, you're needing to get to know them, and we want that type of connectivity to be an effective advocate. The more I know about Representative Howerton, the better I would be able to make decisions in relationship to who she is and what she is about. One of the things that we are grateful for is that 46% of our volunteers have done this for 10 or more years. I find that incredibly humbling to be able to share that with you. People take it on, they incorporate it into their lives, and they just keep going. So that's something that is important in the lives of the people that they serve and in the terms of the work that we do. If you're following in your report, I'm on page 4, and that talks about the process, that working collaboratively. Adult Protective Services does the investigations and determinations whether somebody meets the programmatic guidelines for us, which means they're an adult. They have no family, willing or appropriate, and they are Medicaid recipients. Our part of that process is to identify a volunteer. It's not something where we assign a person saying you will get this person, but rather we call it a meet and greet. You can call it any number of things, where we try to have an opportunity for the two people to meet, the volunteer and the person who will be before the court, to see whether there's a connectivity, if there's something that needs to be recalibrated. And of course, legal the appointment for this is done through the Department for Children and Families Legal and also for KDADS. So each one of those pieces of this triad, one needs to remember that in the context of what it takes for a guardianship or a conservatorship. Once that has established, part of what my staff does is provides that ongoing support and assistance. As you can imagine, the navigation of the systems out there is not uninvolved. If you think about the new committee members to this group and what pieces you're learning to do your job, that's not dissimilar to what we do with an individual in terms of our training and the support, and then that ongoing support once they get into a particular situation. As you can imagine, each one of us in our lives manifests differently. And so while there's a generalized template on all of this, that decision-making must be individualized to each person. On the bottom of page 4, you can see the age breakdown of folks. During fiscal year 2021, we served just under 1,400 different people, and we had a volunteer core of about 772 at the end of the fiscal year. One of the things of significance for us, and I would invite you when you have time, we did a substantive update on our website. It had been, well, it was an antique, and it needed many things in terms of getting more information, how we do that, but also in terms of more accessibility in the background. And so it was a massive, massive undertaking. And the person I have with me today is Chris Radke, and she's our business manager, and she carried an awful lot of water on that together with our web design people. I don't know how I honestly thought it was going to happen, because I had no idea, and I have a little bit more now, and Chris has infinitely more knowledge on all of that. But on that website, we now have training modules, information, basic information about guardianship and conservatorship and the duties and responsibilities. And so there's more out there than we've ever had before. We're thrilled for that, and also it was designed to be more user-friendly in terms of submitting forms. One of the things I omitted back in terms of when, after the appointment, we provide ongoing support, but we also ask a volunteer to provide us with a monthly report on how they're doing, and that's sort of the tether to that stipend. We make available a stipend, which is part of our budget and part of what's funded through this. So they can submit that information through our website. Not that there's not some painful moments sometimes, but the intent is to make it easier in the long haul. You can see some of the other statistics in here, who we serve, people with developmental disabilities. We have mental health, aging. You can see how those services are. And one of the things that I think is of significance, because it is different from when I started doing this a couple of years ago, but 73% of the people we serve are in a community setting or their own home, which means they're not in long-term care, they're not in a state hospital, and they're not in a nursing facility for mental health. And that is huge, because it changes out the equation for the advocacy and the support. You know, if we were to break down our own lives, we would see that we would have 15 to 20 different players in our lives, from our medical to our dentist to our coffee bistro, all of those kinds of things. And so it does change up the game. On page 7, because for us is that we do all of these pieces, but it's about the people. And in this case, this is a young man. The story at the end that I'll end with is a young man who was 20 years old. He came to us at 18. And 2 years ago, his life was not the best. Home was difficult. His parental unit was pulling down his Social Security and using it for street drugs. There were all sorts of individuals who were in the home that weren't positive influences, and great concern for whether there was abuse, neglect going on. Rent wasn't paid, so big chunks of time were spent homeless. He's trying to go to school, so you can imagine going to school was kind of hit and miss. So the supports that came through the school system were sporadic, and so he wasn't able to maximize on this. Out of all of this, there was an investigation relative to abuse, neglect, and exploitation. And in that finding, there was a determination made through Adult Protective Services that this individual could benefit from a guardian and a conservator in this case. And so ultimately, he went to court. Anne was appointed. Critical to getting started is developing a connectivity, finding a relationship, finding points of commonality when you've got this stranger in your life. And so that's what she said about doing. She became a Social Security payee for benefits, which meant that he was still living at home at that moment. They could pay down some of the bills that hadn't been paid so utilities could be turned on. And all during this time, they're having a conversation about, what do you think about when school is done? You're finished in school. Where do you want to go? What are your goals? How can we help you get there? And that conversation was repeated because you can imagine he didn't have a lot of support in his home environment. Over time, his guardian conservator was able to identify affordable housing in the community. And with some trepidation, he made the decision to launch. He had, through the guardianship, reconnected with his grandparents and a half-sister. And so that became supportive as opposed to an antagonistic thing because of the familial situation. They talked about a job, and he still wasn't quite there yet. But over time, he talked with another person who had a sibling with autism. And that was part of what he struggled with. And that sibling had been able to find employment in the community and found fulfillment in that. That success, that connectivity, that conversation gave him greater confidence. And he reached out to try to find some supported employment opportunities. So with that, 2 years later, he is thriving. He's on his own. He's got a great sense of humor, a great relationship with the person who's his guardian. He's been incorporated into their family. And he has a place and a space, and he is finding out what it's like to be a young person in the world and how to work toward independence. And he's an individual that down the road, one of the questions comes, is a guardianship forever? It may be that he will, in a couple of years with some more support, not need this level of legal intervention. And that would be very exciting. We don't do this, obviously, without the amazing core of people that we have out there. These are people in your communities that have stepped forward, who've been willing to say, we want to be an advocate, we want to be a voice. I know one of your representatives is involved in volunteer management and know that that's a significant undertaking, and we're grateful for the support that you provided. The last page is our budget. I think we stand here today appreciative of all the support that you brought to us over the years, and that we are standing with the governor's recommendation. One final, and I apologize for the length of my presentation, but one of the things I want to add is that if we take the total number of people we served and just in an aggregate divided that into our budget, our cost per day is about $2.58, which is almost double when I go for a triple shot latte. Happy to stand for questions, Mr. Chairman.
Very good. Committee questions. Representative Howerton.
Thank you, Mr. Chair. I just want to thank you for your passion. It is obvious. To me, this is the first time I've ever heard of this program, so thank you. Thank you for service. And I love the fact that it's community-based. I love that connection. When you do the math, my questions were, how many are in the guardianship, and then how many volunteers, how many guardianship clients, I don't know what to call them, do the volunteers handle? And I found the information in your report, and that's about they have about two, I don't know what you call them, clients per volunteer.
Good enough.
So is that average? Is that normal? Or what happens if there's not enough volunteers? How does it work then?
Excellent question. Within our program, we have a programmatic guideline, not to exceed 5. We start with 1, 2, and 3, and after 3, they have to come for special permission to go beyond that. And what we look at, because it's an excellent question, what does that volunteer bring to the table? We have some volunteers who say, this is our passion, this is what we want to be about, bring it on. And they can handle, and that's part of what we're keeping track of all the time. We also know that if we go over that sometimes, the challenges can become exponential, and then it's more than a person wants to handle. So the majority of them would be, and I do have that stat. I just happen to have it. 60% have one person, 24 have two. So 1 and 2 sits at about 84%. Statutorily, just to take that to the next level, is that there are parameters within the statute that says, well, we'll look at after 15, but that's up to the court. And the court needs to be made aware of how many cases a person has. But for our purposes, we try to keep that, because the more cases you have, the more complexities you have, and then it just starts to build from there. And what we want to do is, to the extent that we can, create the most optimal environment for being available and present in that person's life.
Representative Lynn.
Thank you, Mr. Chair. You mentioned in that story that he was wanting to be able to live independently and make his own decisions. So how does the guardianship program end? What's that process like?
So I'm going to speak from it from two perspectives. One is that if a person's under the umbrella of our program, and in the looking at how things have been going over a period of time in the assessment, and it appears that he doesn't need to be on his own, we would go back and assist in trying to give them the tools to be able to have that terminated in the court. So it does require a court termination for it to end.
Is that very difficult?
If the person's doing well and there aren't a lot of challenges and there's nobody saying, no, this shouldn't happen, it can happen relatively easily.
Thank you, Mr. Chair.
Now, there would be people who are in the experience who would say it's a lot more difficult than that, but every situation is case by case.
Representative Ballard.
Thank you. Well, as you said, I'm familiar with this program. It's one of the most unique programs I think we have, and I think I'm pretty factual when I say there's not really other programs that fit the guardianship program. Am I correct?
If we go out from the state of Kansas and we start looking nationally at as to how guardianship services are delivered, I hate using that terminology, but for the moment, just to give you a picture, it is, every state has multiple ways in which that service is there. There may be, in California, you have your private fiduciaries. You have county-run programs. You have programs like Catholic Charities in some states who may do this. You may have Lutheran Social Services. You may have private individuals that this is a for-profit business. Particularly when you get into the states like Florida, where you have a large aging population. So the delivery of this has to be multi-pronged to be able to even begin to handle the numbers of cases that are coming forward. And so in terms of what Representative Ballard was referencing is that, yes, there are a handful of volunteer-based programs out there, and some of those are just within a court or within a county. And we are unique, to my knowledge, into how extensively we've been able to do this. But it's been a building process. As you can tell, if you have volunteers who've been doing this for 10 or more years, some of those are 15 and 20, you have to build on your base, your volunteer base.
I say that, well, because I know the answer, but the other thing that I think is unique, the volunteers. I mean, when you have over 700 volunteers and you have over 40% have been there over 10 years or more, you may see where they get like $40 stipend, but that could be the gas they do to do this or the letter they mail, but there's a substantial number don't even take that little stipend that we get. And actually, it was $30 for such a long time before, you know, it's only been for the last 2 years that we raised it, and a lot that don't take it. So we have saved the state of Kansas millions of dollars. Millions.
Yep.
When you have people charging off profit. And it's a program that I think, again, it's almost like that medication unused. You have people, I mean, good people who want to spend their time helping other people, and it's court-ordered, that kind of thing. That it's just a wonderful program, and I really do thank Jean and her staff because they've done just a wonderful job.
They're amazing. And I'll just put out there, because we always are seeking opportunities to tell more about what we do, not in this context, but out there in the community where we're always looking for new people. And if you, that's always our ending pitch. We need more good people.
Very good. Jean, thank you. For committee, further questions? Jean, thank you for being here. Good to see you again.
Thank you, sir.
Okay, very good. That concludes our meeting. Committee, we're going to kind of digress here a little bit. I think I've probably been remiss in the fact that we are going to be electronic. So if you want it in paper, you bring it, you print it off, but bring your computers. We did this all of last year, and we were very successful. But bring your computers. There's just no sense. Today, Alexandria brought in a stack of paper this big of paper copies, and Francie had a stack of all the handouts that was probably a foot tall, and there's just no sense in, you know, wasting that much paper, and so, and her having to pass all those out and deal with it and everything. So everybody, electronic copies, bring your computers. If you want to print it off at your office or whatever and bring it, that's fine, but we will be all electronic again. Right. They'll bring the slideshows for us, KDADS and DCF and some of the big deals, but you'll also have an electronic copy of that also. So, okay, very good. Megan, anything else? Francie, anything else? Okay, very good. We're adjourned.